Good afternoon and welcome to Cut to the Chase with Senator Chase. This is our weekly call-in town hall and radio show. We're here every Thursday, and that's right, I'm State Senator Amanda Chase, your weekly radio show host. I serve you at the state level, not to be confused with the federal level, which meets in D.C. And my office is actually at the state capitol, which is in downtown Richmond. So, we're getting ready. We are gearing up for session as we speak, which is going to begin on January the 10th. It's a Wednesday, the second Wednesday of the first of the year, 2018. And we are working around the clock getting those bills ready. And we're going to be discussing some of those bills. I'd love to have your input on them. And speaking of input, let me give you the phone number so you can call in today. The number is 804 454 1366. That's 804 454 1366. And you can ask your question right here, right now. And, this, for those of you who have not tuned into the show before, this is my first term in office. I'm getting ready to complete my second year. This will be my third session of my 4-year term. I represent the 11th Senatorial District, and that includes all of Amelia, all of Colonial Heights, and most of Chesterfield. I'm a Christian conservative Republican, and in that order, Vice President Mike Pence used that line, and I liked it so much that I'm going to borrow that line from him. I'm a transparent politician, and I actually co-founded the Transparency Caucus, so I tell you that information because I want you to understand my worldview, where I'm coming from. But that said, I like to pride myself on being a good listener, and I listen to all sides, and we can agree to disagree. Sometimes I get new information, but I do listen to my constituents, and that's why we have this weekly call-in town hall radio show. And, when I ran for office, I ran on term limiting career politicians and returning the government back to the people. And my goal is to be a representative who is transparent, accessible, and approachable. I'm not paid to do this show. I've never done radio before, so bear with me here. I do this because I think it's important as elected officials to stay connected to the people that we serve. And I also, before we get started today, I want to thank WNTW for the opportunity to provide this free public service, because if it weren't for them, I probably wouldn't be able to offer this service to you. It is a unique opportunity, and I hope that you'll take advantage of it today. So let's go ahead and get started today. We have been talking about health care in the Commonwealth since Election Day, and I was standing out at the polls on Election Day, greeting many of you as you were coming to vote. And I like to do that. I like to talk to the voters, and many of you said that healthcare was the number one issue, and that agrees with a lot of the exit polls that we were seeing. And so I have actually changed everything I was doing. I was talking about jobs for the most part, and that's still very important that we have jobs, but I'm actually refocusing on healthcare because it's what's important to you. And so since that point, we have done a lot. We've done several shows on Medicaid, looking at what are our options for the everyday average Virginian. We're seeing our health care costs go up. Our premiums are going up the first of the year. I've been talking about this off and on since June, and just my concern, with whether we're talking about CHIP, which is the federal program, the Children's Health Care Insurance Program, and that potentially losing all the funding from the federal government at the end of January. So, there are a number of things. Medicaid is going to be on the table again this coming session. So there's going to be a lot of pressure on the state legislators to consider expanding Medicaid this session. Should we? What would happen if we did? And how does this affect your family? I really want to keep this. I know a lot of times you listen to talk shows and they talk about a lot of different things. I always want to try to keep in mind our listeners and the everyday average consumer, everyday family, and how these policy issues affect you. Today, I have invited a very special guest, and her name is Nancy Piotter. And we actually met at an annual Virginia Tea Party conference that was in Richmond, Virginia this past month. And we were both sitting on a healthcare panel. I was talking about the healthcare transparency cost bill, which I will be introducing this coming session to try to get a hold of those costs, lower them so that the everyday average family can get affordable health care without having to go through the ACA. So, anyway, I asked her if she would be willing to come on the radio, and thankfully she said yes. Nancy is the executive director of Virginians for Quality Healthcare. And let me tell you a little bit about what this group does. It's a grassroots organization of you, the Virginia voters. It is dedicated to restoring health freedom for patients, doctors, and how do they do this, you say? Well, it's through free market reforms that encourage competition, lower health care cost or lower health cost, and individual responsibility. Now, VQH advocates full repeal of the Affordable Care Act, aka Obamacare, which I also agree with. And their goal is to free Americans from federal government interference in personal health decision making. You know, since when did that become a role of the federal government? What about the core functions of government? If we have our taxpayer, we're all paying taxes. And it's traditionally been that that money goes to take care of the core functions of government. And boy, we are way off the mark with that. VQH works to keep Virginia free from governmental-run health care. They are dedicated to increasing the quality, access to medical care by promoting a couple things: realistic, workable, free market healthcare solutions, and by opposing destructive government policies. How many of you like that the government mandates that you have to buy healthcare insurance? When is it an American thing to have your government to force you to purchase something? This organization believes in protecting the doctor-patient relationships, and I just like to add in there, I've been meeting with a number of doctors and nurses and many healthcare providers who tell me that the insurance companies are pretty much dictating to the hospitals and to the doctors what that care is going to look like. The freedom of providers to pursue the best treatment plans for individual patients and the freedom of citizens to make their own healthcare choices. Nancy is retired. She retired in 2011 from a civilian career at the Department of Defense in the field of political military analyst, which really piques my curiosity, Nancy. We're going to have to talk about that on another show because I'm very interested in finding out about that. But she also holds a master's in national security studies from the National Defense University, and she's an active member of the Republican Women of Clifton, and she resides in Fairfax Station. So, Nancy, welcome to Cut to the Chase with Senator Chase.
Thank you so much, Senator Chase. It's really great to have this opportunity to discuss some ideas that we have about healthcare policies, and in particular to inform Virginians who are listening about some new approaches and as well as existing alternatives to the health insurance mess that has become so unaffordable under Obamacare.
You're exactly right, Nancy.
Yeah.
And in fact, most people believe right now we can either expand Medicaid or not expand Medicaid. Those are the two choices that many of us feel, but that is not in fact the case. Tell us a little bit. Let's talk a little bit about the harmful effects of the federal law that many of our listeners are experiencing right now.
Sure. Well, first of all, you mentioned the insurance sort of sector, the health insurance sector. They really are calling the shots, and they're the ones who are getting rich from taxpayers' dollars because the subsidies that the government collects, that they're going largely to the big health insurance companies. So taxpayers are really getting hurt that way. But also the premiums are just skyrocketing. Every year they go up. And I'm not going to daze the listeners with numbers, but because I think everybody probably has personal experience. But people are saying they can't afford to use their insurance because the deductibles and the out-of-pockets are so high.
That's exactly right. They're saying I'm paying both. I'm not only paying expensive monthly premiums. On top of that, because my deductible is $5,000 plus dollars. I'm also having to pay for the very health care that I thought that the insurance was going to take care of, and it's not. It is
Right,
not.
right. And I think particularly egregious is the mandated essential health benefits, the EHB. That is the federal government telling insurance companies what they have to include in their policies. And so everybody's heard of, the men who are required to carry maternity coverage, or women who are required to have prostate cancer insurance. I mean, it's ridiculous. And so those having to include those benefits has really driven up the cost. And we're hoping that Virginia will avail itself of the waivers that are being offered by the Department of Health and Human Services in Washington.
Nancy, we're going to go to a quick break, but when we come back, we're going to hear more from Nancy Piotter. Stay tuned. We'll be right back.
Basketball season is back at Old Dominion University. Hi, this is Ted Alexander. Join ODU Hall of Famer Dave Twardzik and me all season long as Jeff Jones and the Monarch Hoop team searches for their first Conference USA championship. Every basketball season is a long and winding journey. This one promises to be memorable, and you're invited to come along for the ride. Follow the Monarchs all season long on Central Virginia's home for ODU Athletics, WNTW 820 AM and 97.7 FM, The Answer.
I'm not in favor of the bill. I'm not in favor of a law. I am in favor of this thing called parents. It's kind of a unique idea nowadays, I know, but work with me. I know it's so 1950s, and we're in 2017
The government
now.
has already replaced parents. Didn't anyone tell you? No one told you?
What an incredibly good point.
Tune in to the Lee Brothers, Fridays, 3 to 6 p.m. here on Richmond's Choice for Conservative Talk Radio, WNTW 820 AM and 97.7 FM, The Answer.
John Frederick.
Governor McConnell.
He'll show you some love.
That's why we call you Governor McGenius.
And then
the lieutenant governor changed his position on sanctuary cities. First he was for them, then he was not for them, then he was kind of for them, then I don't know what he is. If what you're saying is true, why does he constantly change his position? And by the way,
like hot cocoa spilled on your lap. Richmond, Wake Up with J. Fred, weekday morning 6 to 10 on WNTW AM 820 and 97.7 FM.
If you're struggling to pay or haven't been making your student loan payments, listen carefully to this urgent alert. Have you been out of school for 10 or more years and you're still making your student loan payments? Are your student loans past due or even in default? Can't go back to school because of an old student loan problem? We can help you if you qualify. Your student loans can be taken out of default. We can stop the wage garnishments, stop the collection calls, and stop the seizure of your tax refund. Give yourself a break. Stop the stress and see if we can help you reduce your student loan payments. One quick 10-minute call could solve them right now. So call the Student Loan Helpline now. 800-709-4395, 800-709-4395, 800-709-4395, 800-709-4395. This is a fee-based document preparation service to help you access free government programs. Call for complete details, not available in all states.
Attention! Sorry I'm talking a little loud because I want to reach people with a hearing problem. Do you want to hear better for just $299? Yes, not thousands, but for $299, you can hear all the sounds you've been missing for years. Hearing Help Express has been helping people hear better, selling top-quality hearing aids for over 30 years. Now's your best chance to hear better with hearing aids for only $299, plus a free 45-day home trial offer, and you don't even need to leave your home or get a hearing test. Call now to start your risk-free 45-day home trial offer. Call 888-451-2042. 888-451-2042 for free hearing help consultation. Learn how Hearing Help Express can improve the quality of your life. Visit us online now at hearinghelp.com or call 888-451-2042. 888-451-2042.
We know it was them who sent sound bites of Michael Savage to England to get him banned in England. You Nazi rats, you. You left-wing Nazi rats. Half of you are children of Holocaust survivors. You rats, you've been on drugs so long, you don't even know you become the worst scum on the planet.
Tune in to the Savage Nation weekdays here on Richmond's Choice for Conservative Talk Radio, WNTW 820 AM and 97.7 FM. The Answer.
Welcome back to Cut to the Chase with State Senator Amanda Chase. And the number to call in today is 804-454-1366. That's 804-454-1366. This is our weekly call-in town hall and radio show. And I invite you to take advantage of that number and give us a call. I am joined here with Nancy Piotter, the Executive Director of Virginia for Quality Health Care. Nancy, let's talk about, our listeners are probably experiencing insurance premiums going way up, especially beginning in January. And a lot of them don't understand why this is happening. A lot of the average everyday family who could afford insurance is questioning, how am I going to be able to afford this anymore? And what's going on? I mean, do we, a lot of people I'm talking to are really panicking about this. So can anything be done to mitigate the harmful effects of this law while it remains in place?
Sure. There's, first of all, the tax cut bill that's currently being finalized in Congress, hopefully it will include the, rescission of the individual mandate penalty, which will free individuals to do something besides, buy Obamacare policies. And there are some really exciting alternative models out there, but basically this would free them from having to pay a penalty for not having insurance. But so we hope that stays in the bill. But what I like about the tax cut bill is that it's really a pro-growth bill, and if we can get good economic growth going again, wow, that just opens up so many doors on many fronts, including health care. And so, let's hope that all that comes to pass.
Yeah, and if you look at the S&P 500 and the market, it's doing extremely well. I haven't checked the Dow lately, but earlier today, things were looking really good. Just overall, now you don't hear about that in the mainstream media about how the economy is improving. But I know you were going to talk about some alternatives currently that exist for patients and physicians, because a lot of people, as we were saying, they're looking at their health insurance premiums going way up, and they know that the one thing that we have not done in Virginia is expand, and they're saying, well, this is not working for me, so maybe we expand Medicaid. And I'm like, no, let's talk about this first. We do have other options. Let's talk about some of those other options.
Sure. So in the last session, the General Assembly passed and the governor signed direct primary care.
Which I was a co-patron on, by the way.
Yes, and that's wonderful. We're really excited about this. And so we need to promote it more in Virginia, because this is an arrangement between you and your physician, your primary care physician. And in some cases, that includes some diagnostic tests and things like that. But what it is people may have also heard about concierge medicine. It's kind of a form of direct primary care. But this is a model that has no insurer involved. There's no third party. And so it's just between the doctor and the patient. And the quality of care goes up. We really like that. Patients are happy. Doctors are happy. The doctors are happy because they can set their own rates, which are usually lower than what they would charge if there's a third party involved. And they can see the patients, as often as needed. So that doctor-patient relationship is really strengthened under direct primary care.
The bill that I'm putting forward this year is going to kind of finish off the direct primary care bill. This opens up the door, and now we're going to ask the doctors to provide an estimated cost of services so that the patient knows it's not consistent for all patients. Some people go to the doctor and their doctors work with them up front before they have the services rendered. They already know the cost, but it's not that way consistently across the board. So we're going to give some consistency and give the power to the consumer to make an educated and informed decision based on cost. So just to give you the back end of the direct primary care opens that door for that relationship. Now, this is going to say, okay, let's let the patient know how much their services are going to cost, because right now that's not a best practices for doctors. So keep going.
Right.
Keep
yeah,
going.
so I mean, that will help consumers too, because then they can shop around, and that always brings prices down.
Absolutely. And I think,
So.
in my opinion, that is the single most thing that is driving people's premiums up right now. It's the cost. That's whether we'd expanded Medicaid or not, those premiums are only going to continue to go up unless we get a hold of the healthcare cost. So what other options we have? We mentioned direct primary care. What are other options?
Well, before I leave that subject, there are two other quick points I wanted to make.
Sure.
Just imagine one of the things we're proposing instead of Medicaid expansion is to, and we don't have details about it, but just the idea, the concept of creating a voucher program. So so that lower income Virginians could buy their own health insurance or enter a direct primary care arrangement. And I mean, it just really opens up a lot of possibilities and empowers people.
That is awesome. Now, is there already a bill being put in at the federal level?
No, I mean, these are just ideas that we talked to during the campaign, the recent campaign. We talked with some of the candidates about this, but so that if Virginia could use an innovation waiver to try something, run a pilot program, that might be one way to do this. But it could be pretty interesting. And the second quick point I want to make is that in Ohio, the incoming governor, the governor-elect, has recognized that Medicaid expansion is unsustainable. And so the incoming governor is going to transform the healthcare sector into direct primary care. And I just learned about this yesterday, so I don't have the details, but my gosh, that would be huge. That would be really interesting.
And it's interesting you should mention Ohio, because Ohio was one of the states that had actually went ahead and they expanded Medicaid, and I'll have to look, it's in my notes here, the millions of dollars that blew open their budget. And I was just talking to someone, what did they do? Because I was talking to a surgeon from the Virginia Eye Institute, and he was saying that he was from Ohio, and he said the access to health care in Ohio he felt was better than in Virginia. And I said, well, what about the taxes? And he couldn't answer that question for me. He said, I don't know what they did. So this is great to hear this, because this kind of finishes the story here. It was unsustainable. I imagine they had to raise taxes, because that's typically what they have to do to get the money.
Right, or they cut other areas. And if there's time later, I have some facts about Virginia, how Medicaid has crowded out funding for higher education, in a significant way.
Okay, very good. We have a caller, Steve, who is on the line here, and he wants to talk about buying insurance across state lines. We're getting ready to go to a break, Steve, so when we come back, we're going to take your phone call. So we'll be right back. Stay tuned to Cut to the Chase with Senator Chase. We'll be right back.
With SRN News, I'm Bob Agnew in Washington. One of the most influential Christian radio ministers of our day has passed away, according to media reports. R.C. Sproul, the founder of Ligonier Ministries, has passed away today at the age of 79. 3 votes to 2 right along party lines. That was a picture today as FCC regulators voted to do away with the controversial net neutrality laws imposed under President Obama in 2015. Republican Senator Marco Rubio says he'll vote no on the sweeping tax package unless a child tax credit is more generous to low-income families. The bill would expand the child tax credit to $2,000 from its current level of 1,000. A record number of Americans set to be traveling this year between Christmas and New Year's. AAA says in all, 107 million Americans will travel between December 23rd and New Year's Day, a 3.1% increase over last year. Most of them will be driving. This is SRN News.
The following is not an actor, but a real-life story from Trinity Debt Management.
My husband and I wanted to buy a new car, and we don't have very good credit ratings, so the bank recommended Trinity, so we called them. And the people were very nice. They told us the best solution for our problems.
If you're in debt and you need help, call Trinity at 1-800-990-6976 to talk to a certified counselor.
Trinity consolidated our bills, got us a lower interest rate, and a much better monthly payment.
Trinity will consolidate your accounts into one easy-to-manage monthly payment, put a stop to late fees and over-limit charges, reduce your interest, and possibly improve your credit score. You'll save thousands.
We feel much better now. Things are going pretty well. And since we've been with Trinity, our credit rating has really improved.
If your debt has you down, call Trinity at 1-800-990-6976.
My name is Ann, and we're debt-free for keeps.
1-800-990-6976.
Rates, policy forms, and availability vary by state. I'm 58 years old, married, been working my whole life, got 3 kids done with college and on their own. So, have I scrapped all my life insurance? Heck no. I have more coverage now than ever. When I die, and I know I will, I want my wife to live comfortably without having to worry about money. And I want my kids, and maybe even someday my future grandkids, to have some money so they can start a business or for a down payment on a home. Fact is, there's just no better way to do that for pennies on the dollar than with life insurance. I'm Byron Udell, and I've been talking about this for 30 years. Why? Because it works. If you want to make sure you have life insurance when you die, you have to buy it now while you're alive. Since 1986, AccuQuote has helped hundreds of thousands of people save a fortune on their life insurance. No 3-hour kitchen table face-off either.
Call now, 800-516-2499, 800-516-2499, 800-516-2499. That's 800-516-2499. Want to fly somewhere? Looking for cheap flights or cheap tickets? Then call. That's right. Call the low-cost airline travel hotline now for prices so low we can't publish them anywhere. Low Cost Airlines has all kinds of cheap travel deals. Fly domestically and save up to 75%. You can even fly internationally and save even more. Yes, fly anywhere in the world and save a lot of money on your plane tickets. We'll even save you money with cheap travel deals on hotels, rental cars, even complete travel packages. So don't book your tickets until you call us first for the absolute cheapest prices on U.S. and international airline tickets and hotels. Call right now for prices so low they can't be published. Travel experts are here 24/7 to help.
800-368-5184, 800-368-5184, 800-368-5184, 800-368-5184.
Lately, I've been losing sleep, dreaming about the things that we...
Well, thank you for tuning in today to Cut to the Chase with State Senator Amanda Chase. The number here is 804-454-1366. And Steve, thanks so much for waiting through the break. You had a question for us today.
Yes, I have a question about the status of being able to buy health insurance across state lines. As far as I understood it, the legislation that was considered didn't seem to address that, and I wasn't clear if that's something that the federal government can issue something that would allow that, or does each state have to individually pass legislation to do that? And if so, where is the status? Where does that stand?
Well, I agree with you. I think it's a great idea. That's one of the biggest things that can help us have that competition is to be able to allow purchases of out-of-state health insurance. I completely agree with you. The way it stands right now, insurance firms in each state are protected from interstate competition. It's called the Federal McCarran-Ferguson Act. It was passed way back in 1945. And that grants states the right to regulate health plans within their borders. Large employers who self-insure are actually exempt from these state regulations, but the result has been that we have a patchwork of about 50 different sets of state regulations, and the cost for an insurer that's licensed in one state to enter another state market is often really high. So under the ACA, the Affordable Care Act, it set new standards but retained the strong context of state regulation combined with expanded minimum federal regulations. There are a number of state regulators, there are a number of state legislators who've been interested, including myself, in whether some states allow or facilitate the purchase of health insurance across state boundaries or from out-of-state regulated insurance companies. The National Conference of State Legislatures, State Health Insurance Research and Tracking shows that a slowly growing number of states, I think there are at least 23 maybe, as of this past fall, 2017, state legislators are still considering this idea and have been during the past 10 years. The result includes enacted laws in 6 states and filed bills not passed in at least 17 others. And as of mid-2017, none of the 6 states was known to actually offer or sell such policies, and no consumer has purchased a policy. So we have a lot of work to do in this area, Virginia included. So, it's going to be one of those things that we work with Congressman Bratt's office. But I am going to make a special note to go back and do some research on this for a future segment, because this is a great topic, and I'm going to make sure that there is a bill out there at the state or the federal level, because I agree with you. We need to make sure that we are able to purchase out-of-state health insurance. So I'm going to look into that and see where Virginia is on that. But that's one that we talk about a lot, but what are we doing about it? So let me look into that for you.
Thank you so much.
Yes, thanks for calling in, Steve. You have a great day.
Okay, you do the same.
Okay, I'm making some notes here. Allowing purchase. Thank you. Purchases. Okay, great. This is a great issue, and we need to definitely take a look at what are we doing about out-of-state health insurance and being able to purchase across state lines, because that's another option. Nancy, do you have any comments on that?
I've heard arguments for and against it, so I don't really know. I mean, I learned a lot from you just now about. I do know. I think a bill has been pre-filed again. To allow this, but the concern seems to be to protect Virginians from, some fraudulent insurer from another state. So Virginia, the Insurance Commission wants to look out for the interests of Virginians.
Very good.
I think there is a push for it, so something will happen, but how soon? I don't know.
And it's interesting because right now legislators are all waiting for. We've all filed our legislation, and it's out at Legislative Services, and that we have attorneys that are drafting our legislation, and we actually haven't seen the actual language yet, nor do we know what each other's working on just yet. So it's all going to come about in the next week or two. As the drafters, finish the drafting the legislation, we look at it, approve it, and then it becomes available for everybody to look at. In Virginia, we expect a push by the incoming administration to expand Medicaid. What can you tell those advocating for expansion? And we talked about this a lot last week on my show. Or why should the General Assembly oppose Medicaid expansion?
Well, I mean, we could spend the rest of the day talking about why to oppose it.
Yes.
But I don't want to rehash the arguments that both sides make. But I mean, just looking at it, I think both sides, care about that people have access to health care, and affordable health care. So that's really not the issue. The issue is how can it be paid for? And if you look at the experience, I think it's real important for Virginia to look at the experience of other states that did expand Medicaid. And almost every one of them, I would say 100%, but I haven't, double-checked.
We'll be right back, okay, with Nancy. And
show, because we don't want anybody in this world right now to have to settle for the situation they're in if they want more. There's no reason for it. Everyone has a great amount of power in their life to live the life that they want to live.
Tune in to The Great People Show, live Thursdays 9 a.m. to 10 a.m. and Saturdays 8 a.m. to 9 a.m. here on Richmond's Choice for Inspirational Talk Radio, WNTW 820 a.m. and 97.7 FM. The Answer.
Money, money, money. Money. You gotta have it. When you need it, what do? If you don't have a rich uncle, Call LendingTree. With us, hundreds of banks compete for your business, so you'll get loans with competitive interest rates, and in some cases, with no closing costs. So here's the deal. If you need money, call us. Do you want to refinance your current loan? Are you 62 or older and interested in a reverse mortgage? Then call LendingTree now. 800-470-1378. 800-470-1378. We've closed over $250 billion in loans. We know what we're doing and can help you. Call right now for a free quote. 800-470-1378. 800-470-1378. 800-470-1378. That's 800-470-1378. NMLS number 1136.
Have you written a book and want to get it published? Then call Page Publishing ASAP. We're looking for authors of all types of books. And unlike most publishers, Page Publishing will take the time to review each and every book submitted to us. And we'll give you our feedback. And if we like what we read, we will get your book into bookstores and for sale online at Amazon, the Apple iTunes Store, Barnes & Noble, and other outlets. We handle everything. Editing, cover design, copyright protection, printing, publicity, and distribution. So if you've written a novel, children's book, cookbook, inspirational work, poetry, or a biography and want to get it published, call Page Publishing now for your free author submission kit. Your road to fame and fortune could very well start with this simple phone call.
888-785-0618. 888-785-0618. 888-785-0618. That's 888-785-0618.
Well, that's how a man like Obama gets away with lying, because if you say anything about his lies, they call you a racist. They have been indoctrinated to believe that anyone who criticizes a person of color is by definition a bigot. Even if you're right, you're wrong. This is the problem we're having right now.
Tune in to the Savage Nation weekdays here on Richmond's Choice for Conservative Talk Radio, WNTW 820 AM and 97.7 FM. The Answer.
You're tuning in today to Cut to the Chase with State Senator Amanda Chase, and I have Nancy Piotter, who is the Executive Director for Virginians for Quality Health Care. And we are talking about those who advocate for expansion. What are they not telling us, Nancy?
Well, they're not telling us that, that the estimates that governments have provided, the estimates of new enrollment, are off by a factor of 2. So enrollment has doubled, and that has put so much upward pressure on state budgets. And and also the target population for Medicaid expansion are what's referred to as able-bodied adults or working-age adults, ages 19 to 64. So some states like Maine and Kansas have imposed work requirements on this group, and that's not such a bad thing because it could be a stepping stone, and it is a stepping stone for many of them to become self-sufficient, which should be the goal. We think it should be the goal of any kind of welfare program to not to perpetuate dependency, but to free people from dependency. But in terms of Virginia's budget, because Medicaid spending has grown, it's the fastest growing segment of the budget, and so it has resulted in cuts to higher education, significant cuts to higher education. In fact, some of the listeners might have firsthand experience where of applying to college in state in Virginia and finding that there aren't enough slots because the colleges have are trying to attract out-of-state students who pay more tuition, and that's the way the colleges and universities are handling the cuts from state funds. So anyway, and that discourages lower-income Virginians from being able to get an education that will lead to better-paying jobs. So there are really some huge social costs involved. But
what I find really interesting is that, from what I have seen, have you seen the University of Virginia study? It was one of the largest studies by far conducted. It was done by surgeons at the University of Virginia. They actually examined outcomes for about 900,000 individuals who were undergoing major surgical operations. I believe this was from like 2003 to 2007. And they found that patients on Medicaid were 97% more likely to die in the hospital after surgery than those with private insurance, even when adjusting for age, gender, income, region, and health status. And this is the part that I just couldn't get over, is that Medicaid patients were 13% more likely to die than those who are, get this, uninsured.
Right. I saw a summary of that study, and it was really phenomenal.
I mean, everybody thinks that Medicaid is the program to go to, but they don't realize it's really a broken program already, and why would you want to expand that?
Right. And the health out, you just look at, it seems like the proponents are just concerned about the number of uninsured. I mean, they want to decrease the number of uninsured, and they don't talk about the quality of care or the health outcomes or any of the other factors. But yeah, it's very telling, and there's plenty of research on that.
And the doctors really don't like the Medicaid either, because they say that the Virginia Medicaid program pays doctors 29% less than private insurers did. So
right, and actually trying to find doctors who accept Medicaid is becoming more difficult. So if you throw 400,000 new people onto Medicaid, where are they going to go for their care? So it's not. It's really not the solution. So we just have to. I think we need some new thinking and some fresh ideas to get away from Medicaid, and there's plenty of good ideas out there.
Speaking of the ideas, let's go back to something you mentioned earlier, the voucher program. Let's talk a little bit more about that program, because I think a lot of people aren't familiar with that.
Sure. Well, in Virginia, we spend, I guess the cost for enrollee in Medicaid is about $7,000 a year. The state pays half and the federal government pays half. But what if we took that $7,000 and gave those enrollees a voucher that they could use to buy insurance or to go into a direct primary care arrangement? Or another idea that kind of goes hand in hand with this is creating health savings accounts that are a great way to manage your health care costs. If you did that with a catastrophic insurance policy, everything would be much more affordable. But anyway, we would like to work with a legislator to explore this option. And
well, I can tell you, I know that every listener out there, this is affecting them. I don't know a single person that it's not affecting. And the number one issue that people are telling me is that it is unaffordable. It's, everybody needs help, and what are we going to do? So these are some great options here. Do you have any other ideas for health policy reforms that Virginia should adopt?
Yes, we do. We have the big one is repealing the Certificate of Public Need laws, and I don't know if it's kind of a big technical term to get your arms around, but these are regulations that are out of date, and a lot of states have already repealed them. But these laws artificially restrict the market and restrict access to health facilities because they require a very bureaucratic process for applicants to go through in order to get permission to build a new hospital or provide a new laboratory center. And if COPN were repealed in Virginia, it would increase competition and also bring health care services to the underserved areas of Virginia. And it would be, a free market system. And
what a novel concept.
Really a big push. Right.
I actually sit on a subcommittee called COPN, Certificate of Public Need. And so for the past 2 years, I've done a lot of research, and I agree. There does need to be significant reform with Certificate of Public Need. And, there's definitely, it's a very complicated issue. The hospitals provide a certain level of charity care. And, that's why when you go, I didn't understand this before I was in office, but whenever you go to the emergency room, which having 4 kids, unfortunately, I ended up going to the emergency room with them numerous times, and you see a lot of people just sitting there and waiting, and they didn't have urgent situations. It's people who don't have insurance. They go to the emergency room, and lo and behold, that's hospitals are required to do that, and so they have to absorb that cost, or indirectly it will get passed on to those of us who are paying for that. So it is a complex issue, but I agree with you. There is definitely, I mean, we've got some potential opportunity here to drive down the cost of health insurance by reducing the cost altogether. So Nancy, thank you so much for coming on Cut to the Chase. It's great having you on here, and I know our listeners found it very helpful to hear your suggestions here. So thanks for coming on the show.
Yeah, thank you so much. And if our listeners want more information, please consult our website, which is virginiansforqualityhealthcare.com.
Very good.
Together. Thank you so much.
Thank you. Policy matters. Policy affects your daily life. Whatever decisions are made at the state level do affect you. And so it's important to be informed. It's important to be engaged and know what's going on.
Tune in to Cut to the Chase with Senator Amanda Chase, Thursdays, 4 to 5 p.m. here on Richmond's Choice for Conservative Talk Radio, WNTW 820 AM and 97.7 FM. The Answer.
This Sunday morning, from 11 a.m. till noon, you're invited to join the congregation of Community Bainbridge Baptist Church, 1101 Bainbridge Street in Richmond, for their Sunday morning worship service. You'll hear an inspiring message from the pastor, Dr. Mike McCleary. That's this Sunday morning at 11 a.m. on AM 820 WNTW, where you find the answer.
If you're struggling to pay or haven't been making your student loan payments, listen carefully to this urgent alert. Have you been out of school for 10 or more years and you're still making your student loan payments? Are your student loans past due or even in default? Can't go back to school because of an old student loan problem? We can help you if you qualify. Your student loans can be taken out of default. We can stop the wage garnishments, stop the collection calls, and stop the seizure of your tax refund. Give yourself a break. Stop the stress and see if we can help you reduce your student loan payments. One quick 10-minute call could solve them right now. So call the Student Loan Helpline now. 800-709-4395, 800-709-4395, 800-709-4395, 800-709-4395. This is a fee-based document preparation service to help you access free government programs. Call for complete details, not available in all states.
Attention! Sorry I'm talking a little loud because I want to reach people with a hearing problem. Do you want to hear better for just $299? Yes, not thousands, but for $299, you can hear all the sounds you've been missing for years. Hearing Help Express has been helping people hear better, selling top-quality hearing aids for over 30 years. Now's your best chance to hear better with hearing aids for only $299, plus a free 45-day home trial offer, and you don't even need to leave your home or get a hearing test. Call now to start your risk-free 45-day home trial offer. Call 888-451-2042. 888-451-2042 for free hearing help consultation. Learn how Hearing Help Express can improve the quality of your life. Visit us online now at hearinghelp.com or call 888-451-2042. 888-451-2042.
Can't believe we're already at the final wrap-up of Cut to the Chase with State Senator Amanda Chase at your service here, willing to listen. And I hope you found today's broadcast mind-provoking. We really do, as legislators, want to solve this issue. It is more, my emphasis today is that legislators understand that this is a concern of yours. It's definitely at the top of my list. I want to figure out a way that everyday average families can provide affordable health care for their families. And we have some options here already on the table. I just want you to know that expanding Medicaid is not the only other alternative out there. And a lot of people are saying, there's really only two choices here, to expand Medicaid or not. And if I'm getting my insurance bill and I see my premiums going up to 60%, then boy, would I like to have some type of subsidy so that I can make this more affordable. Those days are over. I can tell you this because the insurance premiums are only going to go up. And why is that? Because the cost of health care is just on the rise. It's unsustainable. And if we don't do something about the cost of health care, it's going to basically be the point where nobody can afford health care. So I'm willing to do that, and so are my colleagues in the Senate. The first step is to make the pricing of health care services cost more transparent, and so I'm hoping that my bill will do that. So you be looking for that. It's still in the drafting process. I've been meeting with physicians and healthcare providers. If you're interested, you can contact my office. Go to amandachaseforsenate.com for my contact information, and let us know you're interested in being a part of that group. I'd love to have your input on this. If there are any healthcare providers that would like to input this. Right now, many of us are just signing a blank check, agreeing to pay an unknown amount with no estimated cost of service. What other industry can you go to? When I go to buy my car, I have an estimated cost of what it's going to cost because there's a sticker price right there, right? But not when you go to your doctor, at least in most cases. I understand some of our dentists do that, and we're very thankful to you, dentists, for doing that. But I went to the doctor last week, interestingly enough, for an annual checkup. They just wanted my insurance card. They didn't tell me nothing, how much it was going to cost. I was just expected to sign away that I was going to pick up the cost for whatever the insurance company didn't pay for, and you have no idea. You have no idea what that cost is. It is basically a blank check, and I'm just tired of doing that. So I want to do something about it. We should know at least an estimated cost of service before we sign on the dotted line that we're going to pay for this. I mean, it's kind of ludicrous if you think about it. But I'm also looking out for doctors here, and I have friends who are doctors, and they say that they're tired of the insurance companies telling them how to treat their patients. So with this bill, it's going to provide doctors an estimated cost of services before the services are provided, and it's actually going to create some competition with the health insurance companies. It's going to hold them accountable. Anyway, stay tuned. Next Thursday from 4 to 5, we'll be back on the air with Cut to the Chase. So hope you'll join us next Thursday. Have a great week.